Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton, and in honor of May being Mental Health Awareness Month, I'm really excited to bring Park Royal Hospital back on our show today and get to know Amber Hintz, who is with Park Royal Hospital. Do you want to tell us a little bit about your role?
Absolutely. So first, I'm happy to be here. Thank you for having me. I've been here at Park Royal since July of 2018. My current role for the facility is Director of Admissions. I've been in that role for just about a year now, and the day-to-day in the intake department is facilitating referrals coming from the community and processing the voluntary assessments that present to the hospital. We collaborate heavily with our providers in the facility to determine the best option in terms of treatment for the patients that present to our hospital. A lot of moving parts in the intake department. When I took over in the department just a year ago, we were working on revamping the culture down in that department. I wanted to put an emphasis on customer service and having a genuine approach to patient-centered care. And we've done tremendous things in the intake department, focusing on an internal customer service as well as an external customer service approach. And within the year, we've made huge strides in the community with our community partners, seeing an increase in the patients that come to us on a voluntary basis. So it's been great things in intake.
Yeah, I can honestly say that I've seen a lot of improvements with community involvement through Park Royal in the last 12 months. So I do attest that to your leadership. So thank you for being a part of that, Amber. That's fantastic. Now let's talk about the stigma of mental health and help us break that stigma, because I think all of us need to hear how easy it is to get treatment and how confidential it is.
Yeah, so we're doing great things already within the facility. We have a phenomenal business development team who does fantastic work out in the community with educating not only the community, but the hospital as well. We offer CE events here in the facility. We do tours within the hospital, and they're very engaged out in the community. So the discussion is there in the community about breaking the stigma. Some statistics that I wanted to reference. 1 in 5 Americans in the U.S. are struggling with a mental health condition. And then 1 in every 25 of those Americans have a serious condition. Schizophrenia, bipolar disorder, or maybe reoccurring major depression. And I think where we need to put more of our focus on is how we talk about the treatment for these individuals. The discussion and the stigma and having the discussion is nice, but what are the next steps? What does it look like to seek help or get help? And that's where I think our focus needs to lie moving forward.
No, that's fantastic. I think those statistics are important because people need to realize that they're not alone.
Right.
Those are big numbers, and it's important to hear. Now, speaking of mental health and this very unique time that we're dealing with, how would you say COVID has affected those people that are out there, even people like myself, and their mental health?
Yeah, we've seen a huge impact with COVID and our hospital and our census. The individuals coming into our facility are reporting financial strain, isolation, just fear of the illness itself, inability to seek services because of our outpatient providers have shut down. They're having difficulty getting their medication. And I was reading an article recently as well regarding COVID and the impact it's had on mental illness. And roughly 45% of Americans say since COVID, they are struggling with their mental health. So we've done things here at the facility to address what we can on an outpatient basis. As I mentioned, in inpatient, we've seen a spike in our census for inpatient, but for outpatient services, we've offered a virtual PHP and IOP, And the plan is to continue to do that in a hybrid fashion as we're slowly opening up more and more. I think that we'll continue with this hybrid version of having the virtual PHP and then the patients presenting in person. And what's unique about that is we'll be able to see the patients who may have a transportation barrier, who need more intense services, and they're not able to attend in person because they don't have transportation.
And that's fantastic. I think that we've learned a lot through this pandemic on how to improve services. And it's amazing that you guys are taking the opportunity to learn from this and offer those services virtually, because you're right, there are a lot of people that can't get into the center that definitely still need that treatment. So we're grateful for that. Talk to me a little bit about what kind of a message you would want to portray to those that are maybe a little hesitant about reaching out to you for help.
Yeah, I'd say you're not alone. We're here for you. I would say that it's why we show up every day. We're in this line, or this field rather, for a reason, and we're truly passionate about the work that we do and the care that we provide. We're a work in progress here at Park Rural Hospital. Going back to the stigma, there is a stigma about behavioral health and psychiatric care. And it was eye-opening for me when I began my career in behavioral health 6 years ago. I started off in the intake department, working as an intake specialist, and you would get phone calls, asking questions or making comments about what it is that your facility looks like, because there is this stigma. And what was eye-opening for me was admitting a patient one time, and she said, wow, you really, I was taking her up to the unit. She said, you really do not look like at all what I envisioned you to be. And that's what I want people to know, is we're not, maybe what someone's told you we are, or what a movie portrays behavioral health to be. We're not straitjackets. We're not padded walls. We're a warm, safe environment. Our hospital presents beautifully, and our quality care is in progress, and we will continue to improve on the care that we provide to our patients in the community.
Perfect. And I can say with emphasis, I have toured your beautiful facility many times, and it is definitely not what one would expect. So it's fantastic. So if somebody was ready to make that commitment towards healing, what would be some of those steps, especially since you're an expert in admissions? Tell me a little bit about that process.
Sure. So first, if they were hesitant to commit to coming in voluntarily, I would say call the intake department. My department is equipped with the skills and resources to provide options for the caller, and that would be a starting point. If they're ready to come in on a voluntary basis to seek treatment, what that would look like is they'd come in and they'd have a very comprehensive assessment done with the intake specialist, and we would take that information and we would staff it with one of our providers, and we would determine the best level of care for that individual. That could be inpatient here at our hospital. We could make referrals out in the community for outpatient services. We have tons of options for shelters if that were the case. We're going to do what we need to do. Our business development team is well equipped as well to assist the intake department if we do run into a situation where we encounter someone where we're not really sure what options are best for them in terms of outside of our services.
Fantastic. I think this is a perfect wrap for what we have gone over this past month with dealing with mental health. So I just want to thank you so much for coming on the show today.
Absolutely. Thank you so much for having me.
Have a great day.
You too as well.